All right, it is a little after 1, so I'm going to call the Platte City County Board of Health meeting to get to order. Anyway, so first order of business is to go with attendance, please.
Artist, here. Dawn,
Here.
Jessica, here. Michael,
Here.
Pam,
Here.
Pete,
Here.
Rod.
Here.
Thank you. So hopefully everyone's had a chance to look at the approval of the agendas next. So if you have a chance to look at the agenda, any additions or any comments, or I'd ask for approval.
I make a motion to approve the agenda. Second.
All in favor?
Aye.
Opposed, same side. All right, we're gonna go to citizen comments. It looks like we had some written comments. Hopefully everyone had a chance to kind of look at those. So do we need to read those, or they're just part of the record?
They're part of the record.
It's part of the record. Okay, so now we're gonna go to verbal comments, and I think we'll go with the audience first. Anyone wishing to make verbal comments before the board, please step forward, give your name, address, comments. Okay, so now we're gonna go, looks like there's none in the room, so we're gonna go online. Who do we have online, Janelle?
The ones that wanted to be online did not want to speak or give comment.
Okay, so we don't have any online either. Okay. All right. So go right into, looks like we have minutes that were from November 17th, 2022 meeting. Hopefully y'all had a chance to look at them. I'd entertain a motion on approval of those or amendments.
Motion to approve.
Second. Okay. All in favor?
Aye.
Oh, same sign, motion carries. Okay, election of officers. We have chair and vice chair up. Does the board have any thoughts or? Right now we have Roger as chair and me as vice chair.
I would make a motion that we continue with that current leadership strategy.
I'd like to move out of one of those positions.
Would you? Okay.
So, yeah, I would like to do that.
And Roger had indicated at one point he would like to not step aside.
Yeah.
But I think he'd be open to the vice chair.
Okay, so he's kind of indicated vice chair.
He had indicated, but he just didn't have the time for the chair.
Okay, okay, yeah, I know it's been really tough for him to get here for chair position, so I think a new chair might be in order. So does anyone have any thoughts?
I have a thought. Don Barnhart, would you consider being the chair?
Yes.
So is that motion?
I make a motion to pick Don Barnhart as the chair.
Okay, second. Okay, we got a second. We'll take a roll call.
Artist,
Yes.
Dawn,
Yes.
Jessica,
Yes.
Mike,
Yes.
Pam,
Yes.
Pete,
Yes.
and Rod.
Yes.
Great. All right, so then we'll go to vice chair.
Yeah, I move to nominate Roger for vice chair.
Oh, yeah.
Second,
Second.
okay. Yeah, we'll do a roll call on that.
Okay, Artist,
Yes.
Dawn,
Yes.
Jessica. Yes. Mike.
Yes.
Pam,
Yes.
Pete,
Yes.
and Rod.
Yes.
Even though he's not here, right?
Yes.
The position.
That's what he gets.
He's not here. So what will be coming up is our 2023 committee appointments, and our new chair will be tasked with looking that over. And if any of you have a desire to be on a board or whatever, I suggest you talk to your new chair and maybe give me your thoughts.
And just know that we are no longer doing the home health operations committee because home health is no longer in existence. So
Right. Well, no.
Yeah.
And I think we had discussions.
And we don't
a while
need
back
COVID.
about COVID.
Yeah, we didn't need COVID anymore either.
We're gonna get rid of that one.
Correct.
Okay.
Do we want to maybe share what boards we have, maybe for Mike,
Sure.
so that you can hear what boards we have and you might want to show an interest?
Sounds great. We have, right now, we have our Environmental Health Committee. Roger was chair. We have Artis and Pam and Dawn on that committee right now. We have a Budget and Finance Committee. Raleigh was chair of that. We have Pam, Artis, and Rod on that one. Behavioral Health Committee, we have a chair of Jessica Malberg. Members were Raleigh Ski and Pete Hybor. Personnel Committee, Pam was chair. Members Don Barnhart, Romilly, and Jessica were on that one. Personnel Committee kind of does the hiring of like health officers, personnel, any personnel matters. Solid Waste Board, of course, was Roger. So we just have one appointed person to serve on the Solid Waste Board because it's in their local, group, and that's by their bylaws. So yeah, so those are the boards. Yeah. So, you know, Dawn, if you have any thoughts or would like to be on those boards. All right. So next, we have appeal of the health officer's decision regarding Myers variance action item. We would like to take that.
So is there somebody here for? Okay. Crystal, this is a variance, so we, not a variance. They had asked for the Environmental Health Board to look at, and myself to look at, or actually me, to look at the setback. So right now, it's a 3 foot, it's only a 3 foot setback from the property line, and the regulations say 10. So I'll let the Crystal talk to that.
Yep, that's the case. So due to the homeowner installing their house, they have to shift the drain field prior to having a septic. They had to shift the drain field into kind of a corner of the property. And in order to fit it, they had to encroach within 10 feet of their own property line. So they're not on the neighbor's property, they're 3 feet off of it. And our regulations say that they must be 10 feet off. That can be achieved by the getting an encroachment from the neighbor to encroach on their property, but the neighbor was not willing to grant that encroachment in this case. Do we have a diagram that we could put on the screen of the site? Yep. Yeah, so you can see the drain field in the northeast corner there. And you could see how it's, just right on the property line. That's the only regulation that's not being met with the drain field being in that, in that location. And then the replacement area, in the northwest corner, that would also need to encroach on that property line.
So there was a drain field there. Did they rebuild the house or?
No, this is a new construction. So they built the house and then they decided to put their drain field in.
They didn't know they were gonna need a drain field?
I would assume they did, but I can't say for sure.
Madam Chair, this time I'll recuse myself from the discussion.
Oh.
Design.
Okay. So Dawn has recused herself from this.
Well, the question of the environmental health board member who's here, the county.
Yeah.
Is it common, like if you put your drainage field into someone else's property, for the county to be like, that's okay, even if the property owner says, I don't want it on this?
It's not on the neighbor's
Oh,
property.
but like-
It's just within the
Yeah.
setback. They just
Okay.
have a setback, and we have, like, with the state,
Yeah.
if we can't get that setback easement, then we have a waiver process.
Okay.
And it's granted to us because it's still on your own property. But it just shows that you're within, you have to not only be 10 feet, but they're within
But it
3
won't
feet.
be, it won't be leaky on the
No,
property. so-
Absolutely not.
Okay.
No.
10-foot setback regulation, is that a county or a state requirement?
It is Blackhead County requirement.
And why was it set at 10 feet?
My understanding was, and maybe Chris will correct me, was when they had set that is if you ever were going to repair or you're going to be throwing dirt when you're doing your trenches, then you are not throwing it onto the neighbor's property when you're building it. So
Well, if a variance is granted, will that impact the adjacent property owner? For instance, can they not do certain things on their property? Like put a drain field within X amount of space of the drain field next, that's next to that.
there is already a drain field on that piece of property and so forth, and it does not have a negative impact on the neighbor at all. And that has always been a question that we've always asked. Why do we have this 10-foot? And why does a neighbor have the right to try to stop you from putting drain fields that close? So
Is that going to impact at all because of that only 3-foot distance? If the neighbor wants to put a fence there, for example, and then something happens to the drain field and it has to be redone. And from what I read in there, it sounds like they do not have an alternate drain field. If there's something up front, this drain field, they have to rework that drain field, correct?
that is correct. That's a lot of times what happens is with this type of drain field, they can work within that 3 feet.
And one of the questions is, are you required before you get a building permit to have a septic permit?
We do not have building permits in Blackhead County.
And Chair, I have a question. There was an allusion in some of this documentation that because they were required to move the well, that's why the drain field is sitting where it is.
So there's a precedent on the property, a certificate of subdivision approval, which is put forth by the DEQ. So they're required to install the well in the location indicated on the certificate of subdivision approval, or else they would have to go through subdivision review for a modified site plan. So they decided to just stick with the approval, the approved area, rather than going back to the state to have that remapped.
And so they do not have an option to move that well.
They would have to go through DEQ review to
And it's quite expensive, is my understanding.
yeah, it's certainly more money and more time.
So this requires action. So if they are appealing my decision to the board. So yeah, that would be your guys' next move.
So I make a recommendation to uphold the appeal, to allow them, yes, that's a motion.
Okay, so a motion's been made to uphold the appeal. 80 seconds. I'll second that.
Okay.
Go ahead.
I'll second it.
Okay, Jessica. All right, any discussion?
Just seems to me that the order in this is wrong, that if they're planning to need, that the drain field should have been done a long time ago, because what would have happened if we denied them this appeal? They wouldn't, I mean, they should have gone in a completely different order.
We actually see that a lot, where people will build their houses first, and then they will then put the drain field in, or apply for a permit, and then,
And then say,
Then-
well, we're causing undue hardship.
yeah,
Well, what would you have said if you said no?
that's right. Well, and that's the thing, and like with this one, something that we've all kind of questioned, that 10 foot, and like Mike had asked, is this a state thing or is it a county? And it is a county rule. I mean, a lot of counties have it, but Flathead County has it, and it's something that we kind of question if we should remove it, because it's on your property. And the thing is, you can drill a well on your boundary, but you can't have a drain field on your, that close. So,
And the reasoning behind it has nothing to do with contamination if it's somebody else's groundwater.
no,
Oh, yeah, so that's a bigger question. Is, yeah, do we need to have that regulation on the book?
well, and that has been something that we've questioned from the beginning of time. What actually was the reason for that?
Isn't there discussions and some bills going through the legislature to talk about some of these rules? Is that one of them?
That is not
That's not
one
one.
of them. It's just well
Okay.
isolation zones and mixing zones.
Okay,
So, but the setbacks are not, so.
so who deals with that? This board? Does this board deal with those regulations? Changing those regulations at the county level?
Yes, we would, when we're doing our rule writing again, when we go back into our construction and so forth, then yes.
And how often is this come up? Do we know? Do we have an idea how often this 10-foot rule?
Most of the time, an encroachment is granted. I would, from my experience, which is limited, just a few years, but I don't think that we've seen a lot of variances come through for this encroachment.
Yeah, normally,
Mostly it's groundwater.
yeah, normally you will get the neighbor to grant it, because once they realize it is not on their property, it's not their property being taken or anything, and so forth, then a lot of times, I'd say 99% of the neighbors will actually grant it to you.
So environmental health right now is going through all of their regulations and everything like that. So this is something that they would bring forward to the environmental health committee to make that, to discuss and to make those decisions and potentially bring forward to the board to make some changes, if any changes need to be done, is what the discussion is at.
And I bring this up just because we've had these variances before and the appeals to them. And if things need to be changed, so that we can make this easier and simpler for everyone, as long as it's not an environmental issue, as long as can interfere with other people's property. I think we should take a hard look at those rules that keep popping up because they're obviously.
On the other side, the person that put the septic system in should have known the regulations and yet didn't. With the expectation that a variance would be granted. That's backwards.
It's presumptuous.
It is.
It's an ongoing problem. It needs to be remedied. That's all I'm saying. We need to take a look at remedy so we don't keep coming back to it.
And did anybody talk to the adjacent property owner to find out why they wouldn't allow it? Yeah, what was
Um,
Probably.
I guess it is my understanding that this lot originally had a sanitary restriction on that. And then in 2013, when the COSA was created, that sanitary restriction was lifted and approval was granted. So that was, I guess, something of frustration.
That they thought that lot could never be built.
I'm sorry, did I understand this lot had a sanitary restriction on it? What does that mean?
So when the lot was created, instead of going through the environmental process to have an approval granted, because it was a certain size lot, they opted to just put a sanitary restriction on it, which kind of postpones the environmental work to be on these people.
What does a sanitary restriction mean?
That no sanitary facilities can be built on the lot unless it goes through a DEQ.
Another thing too is just a little background, those Hewitt tracks. This was a subdivision that was created, I'm gonna say what, in the 50s? And they're real small little lots, and that's why a lot of times they had restrictions on it and so forth. So then they went through the process to lift it, saying that you can have a home that has a septic and well. So, but those lots are fairly small and they're challenging to fit everything on it.
Is there any other, the item here listed that they tried other things to comply with this, you don't see, but is there any other option rather than this variance to get some form of septic system on the property? And I'm not familiar with all the things that are available in order to do that. But is there any other option that might be expensive in order to comply with the rules that you have?
The only option that he could have tried to do was do an elevated sand mound above ground, but the problem is, once you build them, you have a 3-to-1 toe, and that toe would have then been in the well isolation zone. Then it gets into that. So there was no other real way of doing that. Because when you do a mound, sometimes you get half of the drain field size, but you still have to fall within the rules of the 3-to-1 and so forth, because that's above ground.
Other composting system. or-
We cannot, we don't have the luxury of doing composting.
Not with the well.
Discussion anymore? Okay, a motion on the floor and a second, I guess I'll call for a roll call.
Artist,
Yes.
Dawn, oh, Jessica? Yes. Mike,
See,
Pam,
Yes.
Pete,
Yes.
and Ron.
Yes.
Okay,
Are there other of these lots that in this tract that have been not to be developed yet? We know.
Are there still lots with the sanitary?
No, those same with the sanitary restriction.
I believe the lot to the west is undeveloped as well. I'm not sure if there is. I don't think that there is, because I would have looked at to see if this approval is affected.
Madam Chair,
yes,
can I speak to the process?
sure.
The process is discussed in environmental health committee. With it now, once we have upheld that appeal, now that person could go forward with an application for a variance, which this applicant has already had the engineer done. It's just, it was a matter of putting a cart in front of the horse. So by upholding the appeal, now they can move to a variance, and that variance will come to us, correct? Right. So at that point, you can look at what they're proposed, against the 10-foot setback. Right. I just want to make that clear, because I make notes myself when we were talking about how you do that. Turn down or accept the appeal, and that's how.
So next month, we'll probably have the
Variance.
variance then.
Right.
So,
Thanks.
Thank
It's a
you.
little
Yeah,
confusing.
thanks for clarifying that. Perfect.
If they denied the appeal, then it would have gone back and they couldn't have applied for a variance. This is now allowing them to apply for a variance.
And then my understanding is that if we deny it, sometimes they can just go to the state DEQ and say, these rules within the county aren't state rules, and
Yes, yes, they can appeal it to DEQ, but if we had denied it, then, yeah.
Thank you, Crystal.
All right, we'll move to departmental reports. We're gonna start with the animal shelter. Good afternoon, Cliff.
Good afternoon. Welcome to the BOH Meeting, Cliff Bennett. So, keep it brief as always. The December report, the great thing about the December report is it's a calendar year report. The public is used to more reading calendar years, and so for the calendar year, we took in 900 dogs, 907, and 444 cats, and so have you got the other report? The annual report that we use in our software compares us to 10 other shelters in Montana that use our software, and 1,400 and some in the United States. And so it's kind of nice to see how we're doing on certain things. Our euthanasia rate was about 2.67% this year, and the state average of the other 10 was 3.6. So we're right in there with them. And of course, it's much higher in the US because large municipal shelters they don't have enough room for all their animals, so they're going to do a lot more. But the good thing is also we have a very short length of stay. And for dogs, we were 9.5 years and under 2 weeks on cats, and that's considerably under the state average. And so usually those two metrics are mutually exclusive. Either you're high in euthanasia and a short length of stay because the animals aren't there very long, or vice versa. So we have a lot to be proud of on those numbers. And so the other thing that I'd like to report under good news is the Humane Society of Northwest Montana hired a new director, and we had an okay relationship with the past one, but Stacy DeVolt has 20 plus years in the sheltering field. She came down for a walk around and a face-to-face. I really like this woman. She's very, very straightforward and very matter of fact. And she said, we need to be pulling animals out of your shelter. They've been bringing animals from outside of Flathead County. And so that's going to be a huge help to us. And their past board chair had a talk with me during the transition there and said they needed to work on that, and they are. So that will that should help ease some of our crowding. And in return, I got permission from Jen to say we can offer you a few favors in return, and so hopefully we can maybe help out once in a while with spay or neuter surgeries when they're behind, if it fits in our schedule, and a few things like that. And so the two shelters should have a much better relationship for both, much better outcomes as well too. And so I'm very energized about that. Any questions?
I would like to say that Cliff did put in his retirement notice, and he's holding on for us to be able to find another one. But I'd like to take this opportunity to thank you for all of your years of service. You have done a phenomenal job with the shelter, from where the day that we took over to where it is now is light years away from where it was. So thank you for all of your service, and thank you for everything you've done for us. We truly appreciate it.
Thank you for your kind words. And we wouldn't have gotten this far without support from the commissioners and the health officers. And I got a lot of good education. We are following industry practices, and running a shelter in this day and age is no longer a fly by the seat of your pants. There's there's ways to, methods to follow to get animals out alive in a short time period and help operate it in a financially efficient way as well. And so, thank you. And that's why I'm wearing black today.
Well, thanks.
Thank you, Liz.
Okay, next department would be community health.
Hi, my name is Stephanie Tillich. I'm a registered dietitian. I'm from the Flathead Valley. I got my degree at the University of Idaho. My first job was in WIC in Seattle, and I had the opportunity to start working here in April in WIC. I'm a coordinator. And I wanted to report on our December monitoring. Every 2 years, the WIC program gets monitored. And I'm pleased to report we achieved a 91% on our monitoring, which is fantastic. It puts us in tier 1. Tier 1 is for 80% or above. Tier 2 is for programs that score 65 to 79%. And tier 3 is for 64% or less. So meeting the tier 1, we are providing optimal service delivery and compliance with policies and regulations guiding the WIC program. So pretty happy about that. Some of the quality comments that the state gave us is that our agency has great communication with state WIC staff. We have strong use of open-ended questions, reflections, and affirmations with our clients. Our documentation on follow-up appointments is very well organized and clear. Some of the minor infractions that they found were some missing risk codes, not scanning in participant signatures from certified mail receipts when we send out the e-WIC cards, and not documenting verbal acceptance of participant rights and responsibilities. So in order to fix these things, we created a corrective action plan, which I've already submitted to the state and they have accepted it. On Monday, we're going to do trainings with our staff and review the WIC policies and make a plan to fix those things. And one way to monitor that is we're going to be doing quarterly chart reviews, following the policies. Any questions on our December monitoring? We are planning to start seeing clients in office in March, so we're making plans for that. And we are fully staffed, which I'm really grateful for. And one other thing we have done is we created a WIC enrollment form online, so they can just go to the health department website, go to the website and click on it and put their name in, and then we call them in our program. And we've had 14 participants sign up through our WIC enrollment, online enrollment since November.
I have a question about that. So do they have to ever come to the Kalispell office? Let's say there's a WIC person that doesn't have great transportation.
Right?
Can they do everything online and get everything in the mail or like via email or whatever?
They can. Currently, we have waivers in place through July now. So they don't have to be here. Yeah. Anything else?
All right, thank you.
Thank you.
Next will be population health. Go ahead, Lisa.
Good afternoon, Dr. Bohowski, welcome aboard. My name is Lisa Dennison. I'm the emergency preparedness and communicable disease coordinator here with the health department. So just looking at the front page of the report there for communicable disease, I just want to make a note on syphilis. It's quite obvious, it's still rearing its ugly head there. In December, DPHHS did construct a call to action document expressing the severe concern with the increase in syphilis cases both in Montana and nationwide. So they pushed that out to us and to other jurisdictions in Montana, and then we subsequently dispersed that out to local healthcare providers and clinics and healthcare professionals. And what that document relayed was just obviously the concern, along with the guidance for syphilis screening, assessment, testing, and things like that. We are, there's may still be some providers out there that haven't seen syphilis yet, so it's just a good way for them to have the updated guidance right in front of them and know what to look for. We have had some initial cases missed on first appointment to the health or to the clinic, so it's good for the providers to have awareness there. Then moving on to the additional documents there for influenza. So far, it's definitely been an interesting season as we kind of predicted it would be. For the month of December, we did see a significant increase in cases along with hospitalizations. I did thought it would be kind of interesting to include just the comparisons between this year and previous years that we had with influenza. And as you can see in that orange area, it was definitely a sharp increase with cases there compared to previous years where we're seeing the peak a little bit more into the February, March area. So again, it's never too late to get your influenza vaccine. You don't know what the rest of the influenza season is going to look like. So I thought that would be interesting just to show that there. And for the hospitalizations, come back to that. Most of the hospitalizations that we've seen so far did occur in December, where we had 40 hospitalizations. And I think up through today, we're above 50 hospitalizations. It's definitely a rough season so far for healthcare professionals and hospitals. So everybody in the medical field are taking quite a hit this year. And then COVID continues just to be COVID. In the month of November, we did see kind of a decrease where we had maybe about 7.5 cases reported to us during each day. And then we saw an increase in December. We're seeing maybe about 12.8 on average cases per day. And that's kind of plateaued. We're continuing to see about that 12.8 to 13 cases per day into 2023. So we'll just kind of see what comes of that. Is there any questions on reports or?
I have one. Can you give us some demographics on the flu hospitalizations?
Yes, I don't have that pulled up. I can get that for you.
Just roughly, are we looking at older folks, younger?
Yes, definitely a lot above the age of 65. And then interestingly, I think between 45, about 45 to 65. We're not as many pediatric cases, which is good, but definitely kind of middle age and then above 65.
Okay.
I'd be more than happy to provide additional statistics on that.
Yeah. Thanks.
Okay.
Yes.
If I may ask, have we got any serious influenza outbreaks that you're having to try to take care of in the elderly care facilities?
Yes. And that's data I was actually going to try to pull together for you guys, and I didn't get a chance to do that. Our congregate living prevention specialist, Taylor Hunt, has been very busy with influenza-related outbreaks in long-term care facilities and assisted living facilities, along with COVID. So we're seeing still quite a few outbreaks in those facilities, both with COVID and influenza.
Or any of them doing shutting down visitation or anything like that?
Not really. CMS, quite a while back with COVID, really, they have a guideline in there indicating that facilities should not really shut down or should limit visitation to family members that want to come in and see their loved ones in the facility, and then recommending other preventive measures like screening upon entering the facility, maybe limiting the dining services a little bit more, just some of those other mitigation measures rather than having them completely shut down the facility. Although I think it is in there indicating that if the outbreak is continuing, that could be a potential last resort, but it's something that they have to consult with local public health on.
Thank you.
Yeah, and getting also Tamiflu has been difficult as well, which is Tamiflu, because it's been short in supply. So that's been generally known amongst practitioners to be judicious of use of that, because that which can be a helpful tool, but it's been in short supply lately.
Yeah. Thank you. All right, thanks.
about this family planning?
Good afternoon, everyone. So for December,
You want to introduce yourself?
oh, sure. Hi there. I'm Mandy Fleming. I'm the manager of family planning, which is a reproductive health clinic. We also have a harm reduction program and a Ryan White HIV case management program. All right, so in December, despite the holidays and time off for providers, December shaped up to be a pretty solid month for patient visits. I'm really pleased with this calendar year. Patient visits have been staying very steady. Lisa gave me a really good segue into syphilis. So at family planning, our providers have really been doing their due diligence, screening folks for syphilis and testing those who are at risk. I did some numbers, and compared to last calendar year, our syphilis testing went up by 79%. So we are getting people screened and tested. Another barrier for folks who are positive for syphilis is getting the bicillin treatment. If you're underinsured or do not have insurance, a dose can cost over $1,000 out of pocket. So family planning is lucky enough to qualify for 340B. So we can purchase bicillin for about 3 cents a dose. And then treat folks here in the Flathead Valley as long as they establish as a patient. So we've been trying to reach out to other clinics. CD's helped reach out to other clinics. So if they do have a positive syphilis case, they can refer them to family planning and we can treat them for free, just to ensure people are getting that treatment that they need. For our harm reduction program, we this year averaged about a 72% return rate for syringes coming back compared to around 50% last year. So the policy that we created a couple of months ago about returns is having a positive impact on syringes getting back in our doors. In the same calendar year, we've averaged about 42 unique individuals accessing SEP services every month. We see about 6 new folks enrolling in the program every month. You might notice the SEP visits, syringe exchange program visits were down, and that's just due to the holidays and some staff time off. We are looking to now fill that position, the person who was running the syringe exchange program. So we might see numbers kind of dip as we're trying to have staff fill in for those walk-in times. I also wanted to highlight a program that I don't talk a lot about during Board of Health, which is our Ryan White program. So that's the case management program that helps folks who are HIV positive get medical care and they're able to afford their medications. And I'm sure you guys are all aware that the past couple months was open enrollment for the marketplace and insurance. And so our Ryan White nurse case manager worked really hard to ensure that all of our Ryan White folks had insurance. And we just wrapped up that project, and 100% of our participants either have private insurance, Medicaid, or got insurance on the marketplace. So they will have the insurance they need to cover their health care and have access to medications. Any questions? Yeah.
I think like previously they were talking about access to inmates in the jail situation and helping support their healthcare. Is there, are we able to do that or is not?
So we were working really hard to try to get in the jail because we used to provide HIV and hepatitis C testing. And then when COVID hit, we weren't going anymore. We never heard a response back after multiple times reaching out. And last I heard, it sounds like Greater Valley is providing that care. So they're getting care, but just not from us. Other questions? All right, well, thanks, guys.
All right, environmental health, Jim.
Good afternoon, I'm Jim Wardensky, I'm with Environmental Health. And I just wanted to touch on the appeal that you guys were talking about. And understandably, the concern that you had about maybe the homeowner doing things out of sequence or whatever. And, you know, like Artis said, we see that occasionally. And one of the things that we're doing, one of the many things that we're doing to try and combat some of these process hurdles that we're encountering in environmental health is to ensure that we're educating folks and making that guidance available to them through our website, through the application process, you know, so things are put in bold lettering on there. I think recently, in our septic application, we incorporated, something, a sentiment stating, please don't build before you have your septic permit in place, stuff like that. Obviously, we can only control so much in that equation. So sometimes those things come to us and we have to do the best we can to navigate a already difficult situation. So, environmental health remained busy through the months of December and into January, despite the cold weather. Much like many of the industries that have seasonal peaks in their business, environmental health is taking advantage of the reduction in phone calls and walk-in customers by addressing some of the procedural topics that are in desperate need of attention. Air quality regulations and permits are being examined and updated to reflect current resources and requirements. Additionally, environmental health is involved in conversations with multiple stakeholders who are exploring a jointly administered database, which would help with burn permits, fire prevention and response, and data acquisition. Our groundwater monitoring program is being evaluated, and discussions regarding a more navigable and inclusive policy are being had. Many of these processes have been in existence for decades, and due to the population influx in the county, they need to be modernized to meet customer volume, staffing realities, and best practices. Standard operating procedures are being sought division-wide to help improve efficiency and continuity in our work. The advent of the new calendar year brings a flood of various license renewals and new license applications. So when we're thinking about that, I think that our food folks, they have roughly 2,000 inspections that they conduct annually. As an example, I think our front office staff told me yesterday in our weekly meeting that they've processed just over 800 license renewals for the year. We've talked with the state to try and see if we could stagger those license renewals. Unfortunately, the way the state has it set up, they all come at the beginning of the year. So it's a huge influx and very laborious for our staff to deal with those things, but we're getting through it. We've seen a huge increase in vacation rental properties needing to be licensed. Work is being conducted to build up work is being conducted to build upon the efforts of last summer regarding special event response by environmental health. Recently, our staff participated in the planning process for the upcoming ski joring event. Our involvement was initially as an advisory role regarding regulations for food vendors, camping, septic considerations, which essentially is porta potties, potable water use, and a number of valuable insights learned from previous events. Several other seasonal events are on the horizon, such as this weekend, we have the Wedding Expo, I think at the fairgrounds. The Whitefish Winter Carnival is going on, and Cabin Fever Days, a whole host of things where during those events, the sanitarians will be out there working on the weekends, doing food inspections and making sure things are satisfactory. Septic permits, as you saw today, are becoming more challenging as the county continues to increase its population and property becomes scarcer. Seemingly, it requires sanitarians to function as de facto engineers, consultants, attorneys, surveyors, investigators, and fortune tellers. And this is prompting a deeper dive into our septic regulations and procedures to gain a thorough understanding in an effort to guide the public in the correct direction with questions they have. So the last thing that I'd like to share with you is Dave Nixon. David Nixon is one of our mosquito control folks, works with Rob. Yesterday, Dave took his second required test to gain licensure for being a licensed applicator for mosquito control. Passed that. So that's great news. A lot of hard work and studying for him to obtain that. The benefit of that is you always have to have a licensed applicator on duty when you have folks out there doing treatment. So as an example, with Brock being the only one, if he was on vacation or out sick or whatever it was, we couldn't treat. So this way, with both of them being licensed, they can oversee the seasonal folks as well as do the treatments themselves. So, do you have any questions for me? Thank you.
Thank you. How about this?
So Kirk is gone, so we didn't have finance, so he'll be here next month to be able to answer any questions, but that kind of leads me into that we are starting our budget planning for the year. So Kehlani and I and Kirk are having a lot of conversations about where we're at, but I'll leave it to Kirk. I don't think he wanted me to talk too much about it. But things are moving in the right direction, so we're sitting pretty good. Don't know if there's any questions. The home health one is probably the most questionable, but we're still trying to wrap that up. Trying to get money in.
Any questions?
So we have been working with the Behavioral Health Collaborative pretty extensively, and I don't know if you guys want to probably get the committee together and we can sit down and kind of tell you where we're at with the Behavioral Health Collaborative, but we're working with Logan Health, law enforcement, Greater Valley, and just trying to find the gaps that are in the community. That seems to be kind of on the forefront of everybody's mind lately with everything that's going on in the community. So we're working and looking for funding resources and things like that that we can help the community. Obviously, the health department we don't have services that we provide for behavioral health, but all of the other entities do. So we're acting as kind of the conduit that brings everybody together to be able to have everybody on the same page. So everybody's not doing their own thing and be able to collaborate their resources. So that's where we're at with that. We are hiring for the animal shelter. We have been doing interviews. Some of the interviews have been pretty good. So we are going to be looking at scheduling some second interviews and hopefully, because Cliff really wants to retire. But he has been gracious enough to stay a little bit longer for us so that he can onboard the new person, which we're very appreciative of. So right now we're at full staff, with the exception of the animal shelter manager. Things are looking good and numbers are down. So that's a good thing. Numbers are down for the dogs and cats. So Lisa and I went to a hazard mitigation. So what that is it was a regional hazard mitigation plan. And what that is that we're going to work on it with Flathead County, with Juanita at OES, but then also planning and zoning, road department. And what we do is determine what hazards are in the community. Public health has an interest in, because the communicable disease is one of the hazards that they do list, but also a lot of those other hazards that are on there, we may come in afterwards. So forest fires for air quality, flooding for septics and wells and those kinds of things. So we're there at the table, but we are going to be working on that, and hopefully we'll have the new hazard mitigation plan together. It hasn't been, I think, redone since 2014. So lots of conversation. Volcanic ash is on one of them, which is always, I just giggle, but Mount St. Helens, that was the only day that School District 5 canceled in my career of being there. So we got to go to Saturday school for Mount St. Helens. And then it is Cervical Cancer Awareness Month. So we are doing a lot of outreach, trying to get awareness with cervical cancer. A lot of times the breast cancer awareness months are really highlighted, but we really want to highlight cervical cancer and try to get people in for screenings. And so the staff is working hard with that, and also with breast and cervical down in Lake County to try to up the numbers down there to get more people screened. So those are just some of the things that we have going on here, and it's Happy New Year. Any questions on any of that? Okay. And welcome to Dr. Bomarski.
Is HPV vaccination part of the cervical cancer awareness month?
Yeah,
So
we
that's
did.
tied with that as well.
Questions?
I had just one, how, with the addition of Dr. Borowski, have we still got one open?
We do. Yeah, it's opening, has it closed yet? I think it's the 18th, oh, so today. So then the commissioners will appoint after that.
And that's for.
Ronald East,
Yeah.
yeah.
And then regarding like behavioral health committee or the committees, when are we gonna get like the new list of committees? Do you think we should, like, just because Ronald was on the committee, she's not there anymore? just the two of us?
We probably want to wait until
Probably have
the
one.
next member, and then he'll have a full list of who's available, and then maybe Don can reach out to everybody and see if there's an interest in any of the committees, so.
I think in the meantime, we could just use the committees as they're set up. If we have any use committee before we get that new member, we get the new appointments.
Okay.
So speaking of that, I was probably a little remiss, Mr. Boharski, welcome to the board. And would you like to share anything with the board today? Okay. Well,
I don't like being put on the spot. Is that okay to share that?
well, welcome, and artists, welcome back.
Well, thank you.
Yeah.
Thank you for re-upping.
All right, so let's go to, speaking of that, we have the committee reports. I think Environmental Health Committee met. Is there anything else that artists or Don would like to share about the committee meeting we had, or anything else we missed? I know we talked about the Myers thing, but we had some other stuff.
We have some other stuff, but Jim kind of touched on it, where we are revisiting our groundwater monitoring. And then we just have some other things that we're just kind of revisiting. And so in the next couple months, we'll be kind of updating and maybe trying to fix some stuff, but it will be brought to you guys.
I think a lot of it was trying to get the application, the timeframes back in order, and just re-looking at that, try to get that squared away, so you don't end up with so many problems at the end of the day. The other one that I thought was very interesting was that air quality, possibly moving to 12-month burning, open burning, with the single application for a burning permit, or one permit for an entire year, and then we have to just do it all on computer. Say you're going to burn it, say your quality is good. So, and that I'm still looking to help get us to the point that the local fire departments, I think we've got 17 fire departments in the fire valley, being able to do more training burns without such rigorous things they have to meet. They have to, oftentimes what I'm hearing when I've talked to my cohorts in the fire department is, well, some people are just doing it anyhow because the regulations are too stiff. So they're just going and doing it anyhow and saying the heck with it. So I think we kind of need to get a handle on that. And I think by doing that, we need to revisit what it actually takes to allow a verified training burn to take place. I think that's really important, evaluating the safety of the folks in the valley.
But I'm sorry, but they're thinking about going to 12 months?
Right.
So what it is that we currently close it on December, January, and February. There are a lot of days during those months that could be open burning. And what it would do is potentially allow people to safely burn. So that has been kind of the feedback we've gotten from a lot of the fire districts, is that people are desperately trying to burn in times that may not be great for burning. So it would be able to be closed if we were to, these are just proposals, but it would have to meet air quality. So we wouldn't be able to have an inversion during those days and that kind of thing. But we would open it up so that there was parameters to allow people to safely burn. If one of the other talks is in that 12-month is that we would be able to work with the fire departments, and the fire departments would be able to close it as well. And the idea is that we open it up because it's a great burn day, because it's high wind, winds of 20, and so everything's going to be blown out. But it's not a great day for the fire departments. So they could run into quick grass fires, and they could run into other things that they're, DNRC gets called out, I think they said 40 times, last year they got called out 40 times where we had good air quality days, but it was very dry where they had to be called out. So it would be allowing a collaboration between all of those entities to make it safer for our firefighters and also not to smolder everybody in the valley with air quality. So if we could open that, it's just another option to look at. And we're very early in the discussions.
And there is one other aspect to that, and that is who are the air quality police? You know, if someone is safely burning and the air quality is said that you can't burn, the fire department is called out, the person is doing a safe burn. Fire department put that out.
Those are discussions.
Who do you call?
Ghostbusters.
Who do you call? Yeah. If the fire departments don't want it, they're not gonna write tickets, obviously, and everything else, but they're getting called out to these and, you know, just something to
Yep,
keep.
absolutely.
Thank you.
Some more to come. Thank you.
All right, question about kind of everything we talked about. Are there any incentives that we could give to like the bigger builders to say like about the septic, say, like before they build a house, maybe advise the owner, okay, we check with the county? Like, is there any kind of public information? Are they familiar with that? Or are they just kind of like, they're so busy, they just want to get it done?
Well, you know, my experience has been oftentimes anymore, that it's the homeowner that's pushing this. In other words, the homeowner is saying, I'm gonna take care, I got this piece of property, and I'm going to go ahead, I wanna get my house built. This is where I want my house, so I'm gonna get my house built. Oh, by the way, I guess I better have somewhere when I pull the handle.
Yeah.
So that's gotta go somewhere. So then they look at that and say, okay, now you have, where's your well gonna go? And unless it's specified in the subdivision, specifically set out in subdivision, it's just pretty much wide open. So who directs them?
Yeah.
I don't know. And I think that's where you run into most of your problems. And Jim might want to address.
So one of the things I think that recently that's happened is because of the huge influx of people and building and all of that stuff, one of the things that's happened is from a scheduling standpoint, we've seen a backlog, you know, with getting builders, with acquiring materials. You know, we've heard that as far as septic tank goes, obtaining septic tanks, that there's been a huge delay in that. You know, so one of the things that I've commonly heard is, you know, we can't get an installer until X date, but can we pre-order our tank and get all that and get the tank in to try and expedite the process? So I think sometimes what's happening is, you know, people are excited about getting their residence built or whatever it is. And if it's gonna take X amount of time to get the septic, well, then let's get the house built while we're waiting for everything else. And then again, from our standpoint, you know, we have a backlog of anywhere from 10 to 12 weeks before we're able to get out and do site evaluations and things of that nature, just because of the volume of work. So that sets the whole septic process back. And then further complicate things, you know, and we've talked about this, a lot of the properties that are available for development now are not really desirable properties as far as septic systems go, groundwater, things of that nature. So it's not as easy as, you know, the standard septic application and process. You know, there's a lot of things that go into it. And, I mean, you just had a glimpse here today of, you know, when you're talking about setbacks and groundwater and you know, non-degradation and, you know, there's a ton of different things that go into it. So, you know, for the average person, and we hear it daily at our counter, you know, if I come in today, can I have my septic permit done by next week? You know, it's like, no, not even close, sorry, you know. So, and they've already sold their house wherever they're coming from, or, you know, are eager because of the loan that they've obtained to build. And so it's just a whole host of things that, and like I said previously, you know, we're doing our best to try and educate folks so they don't get themselves into that bind. You know, where, oh, you've limited the space that's available to you because you've already constructed a dwelling, you know. And that furthers the question, like you guys had posed today, well, what if we deny it? You know, I mean, so, you know, that's something that we're gonna have to address going forward too, is, you know, if it's something where it's just absolutely cannot occur, based on your judgment, how do we handle that? Because we're talking, you know, tens, maybe hundreds of thousands of dollars, you know, and to bear that bad news is not fun. So,
Thank you. All right. So, Mike, this is a time when we just go around and have the board members share whatever they'd like to share with us if they have anything. So I'm gonna leave you for last in case you can think of anything. So I'm gonna start with Pete today, board member discussion.
Yeah, just welcome to Mike. I had the honor of practicing with him and knowing him as a colleague while he was still practicing for a number of years. And I'll just say that you have a number of patients who still remember you fondly and have appreciated your clinical expertise. So I appreciate your membership on this board.
Thanks, we're happy to hear.
Yep, same, welcome aboard, thank you for stepping up, it's not that many people that are anxious to do that anymore, volunteering, so thank you for doing that.
All right, same. That's all I got.
My turn? Your turn. Gosh, welcome, and this is volunteer. I'm still with you.
A lot.
Now, I want to talk for a second here to Cliff. My 8-pound dog, I believe we're on, and we did our first DNA test because Zephyr, when we got Zephyr about 1.5 years ago, it was Aspen when you had her. And Aspen is, we don't even know what, she was a stray, so you had no information on her.
They never tell us.
And she was quiet, and now we know why. Her lineage was floozies, okay? So we have this dog that's just so unique that it's not even alphabet soup, but that's why it's Zephyr. It started at the end of the alphabet. And it turns out that she is Australian cattle dog. Welcome to the Flathead, okay, melting pot of the world. Rottweiler, German Shepherd, Irish Setter, Yorkie, she's got some Yorkie in her, and a Poodle, which is like a Rastafarian looking giant dog, and Tibetan Mastiff. So this dog's been, and some Alaskan Malamute, just a little bit of that too. This dog has been all over the world, and she's come to the Flathead Valley. So she's been a great addition to our family, and it's been a pleasure doing business with your staff for 4 of our children and many of their pets. So I will miss you, but welcome to the wonderful world of retirement if they ever let you go.
Thank you.
Well, thank you for joining us and so forth. And I do have just a question of Jen or maybe Pam. What is happening with our settlement?
Oh, sure.
That was just the,
Well, just this month, we were supposed to close on the property January 13th. We had to extend that out a month, so now it'll be in the middle of February. I don't know the exact date. We are still doing our due diligence on that, and that's the reason for the extension, 30-day extension. We have gotten some of the reports back. I think the Alta survey and that is all back. The MIPA's still got some things, I think, going on. We didn't have a business plan, which may or may not, we're not too worried about that. You know, it is good to have, but mostly the environmental, geology, that type of stuff. So yeah, we're just doing our due diligence still. And then we'll see where it goes, but it's middle of February before we'll know on the property if that moves forward. Do you have anything to add?
No, it's just, yeah, they're just kind of in holding pattern. The engineers asked for a month
Yeah.
extension to just make sure that everything was done correctly and that to see if this is a viable property or not.
We were invited, the commissioners were invited down to Big Fork Water and Sewer last week to tour their facility. I've been there a couple times. It was really good for the other two to go down and just see what goes on down there. For those that don't know, their facility is right kind of in downtown Big Fork, right there. They discharge just below the bridge, highway bridge, and it's just amazing what they do down there. If you ever get a chance, go down there and ask for a tour, because
So it's right next to the Flathead Brewery.
It's
Yeah.
below the Planet Brewery.
below the,
Okay.
yeah, it used to be the bowling alley there. Right
Yeah,
down there
sure.
amongst those condominiums and everything.
Yep.
Nobody even knows, a lot of them don't even know it's a water or sewer treatment plant. They fit very well into the neighborhood. She said they have very little odor problems. Sometimes in the summer when it really gets hot, they may get a little bit of odor, but they also get odor from the brewery. So when they're doing their brewing, so they fit very well into the neighborhood and they're very neighborly to their neighbors. So it's good. You can, there are ways to be a good neighbor when you're doing this type of facility and we still have access that we have to look at, traffic, there's just still things we're looking at, making sure we cover all of our bases. But we're getting a lot of good feedback, some negative, of course, but we're getting the pumpers, porta potty people. They're just very excited that they're going to have an avenue to get rid of the effluent that they have to pump. I mean, it's just a matter of what, we got it out there, we got to take care of it. So some of them have called me and said that they are losing they're getting notice that the farmland is going away. They want us to build it like this summer, which I'm not sure that's going to happen because there's still a lot of steps to go through. They're concerned. They don't know what they're going to do if their farmland goes away before we get this up and running. It's a big question mark on how that's going to work. So we're working as fast as we can to try to accommodate. Porta potties may still be a problem this summer if you're looking to have an event. They don't have anywhere to take their stuff. So yeah, it's we've been waiting a long time. We're finally moving forward, and I think it's just going to be wonderful when we finally get to breaking ground and take care of what's going on out there.
And I have a question for clarification. Is this still the original piece we were looking at? Because I know it was brought forward, there may be another piece that was offered. So this is still the original piece?
This is still the original piece. There was never any other offer.
I know what we're talking about.
It was talked about, but it was never really offered up as a possibility.
HDR has other sites potential if this one falls through.
Yeah.
That was part of their contract that they had to identify other places that are for sale that they would be able to pursue, but not anything that they've actually pursued because you have to go to one first to decide if that one's okay before you do anything else. So
Yeah, and that all tied to funding too. We had to identify a project and a location, keep our funding and, so which we definitely want to, that's a high priority, of course, keep our funding in place. So, yeah.
And how long do we have on that funding? Like,
Well, we have time.
as long as we keep moving forward.
As long as we keep moving forward, we got it. Yeah. So, yeah.
Thank you.
Project. Anything else? Your turn.
Thank you for allowing me to be on the board and make me feel very welcome. I'm impressed by all the people that are on the board, all the personnel and all the department folks too. So hopefully I can have something in the future. So be helpful.
Great. All right. Okay, with that, entertain a motion to adjourn.
Make a motion to adjourn.
All right.
I'll second that.
All